It's been almost 50 years since man went to the moon, and the greatest reward from that exploration is the fact that the inhalation of iron particulate matter can cause significant hypertension and impairment in cardiac function and heart attacks. The inhalation of iron dust is killing us. Studies of moonwalkers who brought iron-laden lunar dust into the habitats on their spacesuits can be fruitful in determining the impact of urban pollution on hypertension triggered by inhalation of hazardous particulate matter associated with alterations in both heart rate and blood pressure. Lunar dust consists predominantly of nano-sized metallic iron particles. With spaceflight, there's invariably diminished thirst, atrophy of water storage sites and skeletal muscles, leaking of plasma through defective capillaries. This dehydration triggers angiotensin and catecholamine elevations and vicious cycles with magnesium ion deficits, with in turn cytokine elevations and oxidative stress. Imagine the fact that each one of us has at least 50,000 miles of blood vessels. And imagine that a submarine is going through these 50,000 miles of blood vessels, and the submarine carries oxidative stress with torpedoes. And the one that I want to focus on is what I've listed in red: excessive iron. As far as protection is concerned from this oxidative stress, I've listed the depth charges on the other side, and I've placed in red the fact that the female advantage of donating blood with menstruation is a tremendous advantage. Males can offset this disadvantage by giving blood, perhaps a unit of blood, every 3 to 4 months throughout the year up until possibly age 80. This is a slide showing the invariable reductions of magnesium in space because there is a loss of storage sites of magnesium in the skeletal muscle and a loss of storage sites of magnesium in bones, with 1 to 2% loss of bone every month, no matter how much one exercises in microgravity. Notice that the serum levels of magnesium are significantly reduced with a level of less than 0.0001, despite the fact that the serum lacks sensitivity. With a loss of plasma volume, after just 5 days in space, the catecholamine elevations are twice the supine levels on Earth. With a reduction in intravascular volume, there is an increase in angiotensin followed by an increased release of catecholamines. Magnesium inhibits catecholamine release from the adrenal medulla. Magnesium deficiencies with spaceflight may trigger congestive heart failure. Correcting magnesium deficiencies may prolong life. This paper in 2012 was selected by the Global Medical Discovery as one of the top 20 of 20,000 peer-reviewed papers published in Science and in Medicine. Notice this slide. Notice the projections after 12 days of a rat in space. Notice the projections from the endothelium. Each one of these projection sites is a source of loss of the critical level of magnesium through these sites. This is a slide showing that the James Irwin returned after Apollo 15 after his 12-day mission with 67 hours on the lunar surface. He orbited the moon for 48 hours, 3 spacewalks, and then 3-day return to Earth. And the day after return, his bicycle stress test was 275 over 125 after only 3 minutes of exercise. Now, Irwin had hypertension and really, in retrospect, never should have been selected as an astronaut because one of his blood pressures was 145 over 110 a month prior to liftoff. Having supervised over 5,000 symptom-limited maximum treadmill stress tests, all hospital-based, I have never seen blood pressures approaching that level. This slide is a way of looking at the heart rate of Armstrong in comparison to Collins and Aldrin, who accompanied Armstrong on Apollo 11. And notice that even without looking and without noticing or without noting what the heart rates are, just looking at it, one can see that the heart rate of Armstrong is significantly higher than the heart rate of Collins and Aldrin, and this indicates that Armstrong is what is referred to as a hot responder, one that has high adrenaline levels and in turn high heart rates, and this is triggered by dehydration would be one way, and an important way in as far as space is concerned is the invariable reductions in magnesium levels, and with reductions in magnesium there is in turn an elevation of catecholamines. Armstrong never really believed in exercise, and one of the mechanisms of his very high heart rate might be his philosophy of not exercising sufficiently, which would otherwise bring his heart rates down. This is a slide showing that on the moon, Irwin, while he was configuring the lunar module, had a heart rate all the way up to 167. Now, this level of 167 is extraordinarily elevated, and if one assumes that Irwin's heart rate at age 39 would have been about 180, this heart rate of 167 is above 85% of his maximum heart rate, and it portends sudden death. This is a slide showing mechanisms related to microgravity, and with the elevations of angiotensin, there is in turn oxidative stress. There are vicious cycles between magnesium ions and catecholamines, and with increase in oxidative stress triggered by ischemia, with reperfusion, and with moon dust inhalation, there would be in turn increase in calcium overload, and really there is a vicious cycle also between calcium overload and oxidative stress. This oxidative stress causes endothelial dysfunction, and another factor is that during the MER, it was found that the CO2 levels were 10 times higher than the CO2 levels on Earth, and this is conducive to calcium overload. Also, with magnesium deficiencies, there is increase in the endothelin levels and cytokine levels, and this would be also complicated by moon dust, which would also increase both the endothelin and cytokines. And then, since there is invariably sleep deprivation in space, with the average duration only 6 hours, this would also induce increase in cytokine levels and oxidative stress. This is a slide showing that there really are 4 vicious cycles in space flight between magnesium ions and catecholamines, between ischemia and catecholamines, between magnesium ions and aldosterone. Notice that for the synthesis of transferrin, both magnesium ions and insulin are required. Transferrin is very, very important because if the transferrin levels are too low, there is in turn oxidative stress. And this has been reported and published repeatedly that the transferrin levels are reduced in space. And magnesium is required for the synthesis of transferrin. This shows that iron levels in lunar dust are very high. The iron is a potential agent for inducing an inflammatory response, vasoconstriction, oxidative stress, arrhythmias, and heart failure. And in addition, on Apollo 15, James Irwin experienced severe tachycardia, arrhythmias, and heart failure. After landing, he presented with cyanosis of the nail beds, along with his extraordinary stress test hypertension. This finding, which I found several years ago of Irwin's cyanosis of nail beds, supports my Apollo 15 syndrome. There are only 4 published space syndromes, and I have published 2, the Apollo 15 space syndrome and the Neil Armstrong syndrome. So I was very pleased to find this publication of Irwin's cyanosis of the nail beds, and it would support the Apollo 15 syndrome. I published that the pain that Irwin experienced in space of the fingernails was related probably or triggered by plasma fluid to an excessive level in the distal portions of the fingers. And Irwin found that on his second and third excursion, after having trimmed his fingernails, he had no experience. He did not experience any pain in the fingernails. So, with the finding later of cyanosis of the nail bed, this would indicate that venous blood could be trapped peripherally, and that would be the explanation for the cyanosis. On the day of return of the Apollo 15 mission in 1971, this is the historical document, which is now almost 50 years old, showing that on the 18th, 19th, and 20th minute of a stress test on Irwin's return, there was indeed cyanosis of the nail beds. This is a very important historical document. This slide shows that as far as urban pollution and hypertension is concerned, the important factors are inhalation of fine particles, urban dust, and ambient air, and impaired endothelial function. And with exposure to the constituents of particulate matter, especially iron, this may be the etiology of the increased blood pressure in children in the PIAMA study. This study from the Netherlands in 2015 is a strong supporting paper for my hypothesis that the iron brake dust is a major contributor of high blood pressure. The article publishes the fact that there was increased iron exposure in the children, in the 12-year-olds, but there was no mention as to what the source might be. But I have shown that overexposure, it has been shown that overexposure to heavy metals in the air can cause cardiovascular disorders. This PIAMA study is a very important slide because it shows that the 12-year-olds have increased diastolic blood pressure. This was a study of 1,500 12-year-olds, and it's very interesting that Neil Armstrong returned to Earth also with an elevation of his diastolic blood pressure, and this elevation of the diastolic blood pressure is consistent with impaired heart function. Neil Armstrong's diastolic blood pressure was very, very high at 135 in comparison to his resting diastolic blood pressure of 80, so that he had an elevation with exercise all the way up a 50 millimeter increase during his stress test. This slide is a very, very important slide. Using magnesium iron dust indoors, this Poli study found that there is an elevation of dust indoors, and the implication is clearly this, that if one thinks that they can escape the risk of iron dust by using a treadmill indoors, they're mistaken, because these fine nanoparticles can easily penetrate through a door, through the windows, and it means that one has no protection by exercising indoors as opposed to running outdoors. It's very, very discouraging. One of the most important non-exhaust traffic-related environmental hazards is brake wear. Most researchers have reported iron, copper, zinc, lead to be the most abundant metals in brake lining, but at least 90% of brakes are made of iron because iron is strong and it's cheap. Irwin, on a return from his Apollo 15 mission, had severe dyspnea and classical angina during Earth re-entry at 7 G-forces, and returned with this extraordinary stress test, hypertension, which I mentioned, with a blood pressure 275 over 125, and again I repeat that having supervised over 5,000 symptom-limited maximum hospital-based treadmill stress tests, I have never seen blood pressures approaching this level, and this was, in Irwin's case, after just 3 minutes of exercise. The trigger is iron brake dust release, and I've already mentioned the fact that there is no protection from exercising indoors, and this study in the New England Journal of Medicine in 2004 shows that exposure to traffic also increases not only the risk of high blood pressure, but also the risk of a myocardial infarction, and the mechanisms would be similar to the mechanisms which I've already outlined as far as the Apollo missions are concerned, for example. This is a very important slide, or photo really. It was taken within about 10 miles of my home in Virginia, and it shows that although iron is released from tires as well as brakes, this photo clearly shows that the source of iron dust is from the brakes and not from the tires. Notice that the road going down this very steep road from the top of the paved top of the mountain is brown, whereas the road going up is gray. Conclusions. Very recently a decision was made that guidelines for hypertension should be reset down to 130 over 80 based upon the American Heart Association conclusion along with the American College of Cardiology. With new guidelines, the incidence of hypertension in the United States is reset at half instead of a third of the incidence in the world. Iron dust released from brakes may play a major role in hypertension and myocardial infarctions. Legislation will be required to prevent the manufacture of iron brakes. I call your attention to my website and my email address is there. Feel free to send me a request for any questions that you might have, and I greatly appreciate the invitation to present my work. Thank you.